Good morning. It's Wednesday, surgery day, and I have a lot of cases, so let's do some surgery. C-section, 2 hysterectomies, a couple circs, a cone, and a diagnostic laparoscopy, and we'll see what else we get into. C-section number 1 is done. A beautiful baby girl, and she's a big girl, 11 pounds. That's why we did a C-section. It was about 5,000 grams, so I'm very glad we did a C-section, and so is this mommy. So mom and baby are healthy, and next we go to hysterectomy. My hysterectomy patient is all checked in. Now I'm gonna go around. I got 2 postpartum patients to see. Oatmeal, no coffee. All right, rounds are done, and I got some coffee, had some breakfast with the team, and now we're gonna go do our hysterectomy. Quick body break. Hysterectomy is done. We did a hysterectomy with BSO, so bilateral tubes and ovaries, and we took and we did a posterior repair. I did a circumcision, I did some post-op orders, I talked to the family, and now I'm gonna go do a cold knife cone. Let's go cut out some pre-cancer. All done with the cone, no more pre-cancer. So cold knife cones are actually one of my very favorite procedures. They're quick, they're easy, they prevent cancer, and they're really fun. So I do it in a little way where I get to use a kind of a parachute method is what I call it. I read about it online and it works so good. My resident was like, that's so easy. But seriously, it's such a fun case. I did some more charting. I discharged patients and I got all the post-op meds ready for these last 2 cases. And now I'm gonna go do a diagnostic laparoscopy. Done with the laparoscopy. She ended up having a hydrosalpinx and lots of adhesions. There's even some Fitzhugh-Curtis syndrome. And so we were able to clean all of that up and restore normal anatomy with the exception of her left fallopian tube being removed. Her right tube was pretty adhesed, and so I'm not sure if that one's going to function, but all of the pain sources should be out and she's going to feel a lot better. So not exactly what we were hoping for because that right tube looks like it might not work long term, but she can feel a lot better, and we restored normal anatomy, and we're going to hope and pray that it heals well. Overall though, a really good day. I did 4 cases, 1 C-section, 1 hysterectomy with bilateral salpingo oophorectomy, so tubes and ovaries, and we did a posterior repair on her. We did a cold knife cone for precancer of the cervix, and we did a diagnostic laparoscopy with left hydrosalpinx removal and lysis of adhesions. And it is now 3:59, so I'm gonna put in these last orders and be home on time. Hope you had fun following me.